My name is Leah Sanchez, and I practice with the Neurology Center of East Alabama, which is part of the East Alabama Health System. When I was a little girl, I was fortunate enough to have strong female role models, and I had an aunt who was an internal medicine specialist, a hematologist actually. Her husband was my pediatrician, and so I got exposed to the medical field really early on. I was born and raised in the Philippines. This was my childhood in the Philippines, and these aunt and uncle of mine were trained in the US, and I had such great admiration for them, and that was encouraged by my family. I come from a family of engineers and business people, so I was kind of the odd one out, but they wanted at least one child out of 6 to become a doctor. That was strongly encouraged, and it was kind of ingrained to some degree, but I personally enjoyed watching my aunt and uncle and really wanted to do something similar. Pediatric neurologists in general are medical doctors who have had specialized training, first of all with pediatrics and then with neurology. Neurology is a subspecialty that deals with disorders of the nervous system, which really involve the brain, the spinal cord, the peripheral nerves, and the muscles in general. So it's interesting in that regard. It is very dynamic and it's very interesting. Now, most child neurologists would probably say that the bread and butter of neurology or child neurology are seizures and headaches. Those are the most common things, some developmental delay. But every now and then we will get very interesting cases that will help us think again. And so it's an interesting field. And pediatric neurology is different than adult neurology because, first of all, kids are not little adults. Any pediatrician will tell you that. Their brain is evolving and developing, and so there are changes that happen along the way that you have to adjust for. So it is very interesting and dynamic in that regard. I encourage families who may have concerns that they feel that a neurologist might be able to help them with, to talk to their pediatricians and to find out if seeing a neurologist would be appropriate. I have been a child neurologist since 1995. That's when I graduated from my training in the Albert Einstein Montefiore program in New York. And I ended up in Montgomery 20 years ago. My kids were growing up, and then right before the pandemic, my youngest graduated. And so I was in the thought process of what do I do now? And then East Alabama was looking for a child neurologist. So kind of like they were looking, and I was in a position that I could make some changes. I'm just delighted to be here, and as people say, change is a little bit difficult initially, but I am optimistic that in a few weeks things will get smoother, and that I will be able to see more patients, be more involved in the community. And that's something that I really look forward to. I have really enjoyed meeting everybody. I see that so many committed professionals and community members alike that have been very welcoming, and I see the commitment to making the medical community thrive in such a way that it can serve the community better. I like being part of that. It's been very helpful, and I really look forward to doing more as I get adjusted.